The Hua Tuo points are very important in orthopedic work for a couple of reasons. The first is that if the person's had a sudden accident like whiplash or a fall or a jolt, all the muscles in the body will go, ugh, and then the big muscles will let back. But those muscles that are close to the spine are not used to opening and closing the way a bicep does. So when they seize, when they go back open, they don't open all the way frequently. Or they'll get hard, and when they're hard, they pull. And the person always has this sort of, they never feel quite right. They're always off a little bit. Now, it's important to know that depending on how the injury happened, it can be the same side Hua Tuo, or it can be the opposite side. Very important to think about that, because these muscles, the way they stay on the body is not only they attach to these Hua Tuo, but they cross over a little bit like a hook. That's why bones have lots of those hard, ridgy spots. I showed it in the video, that things attach to the hard, ridgy spots. And so sometimes we have to get the opposite Hua Tuos so that if this side's always tight, I needle the opposite and it gets that length. Other times it's gotten scrunched on the same side and I need to get in and let it go. For orthopedic, usually the Hua Tuos are needled. So here's the vertebra, here's the space, we come over, and I'm trying to get where they attach on those vertebra phalanges, the shape, the wings, okay? Internal, if you were doing it in China traditionally, you would move a little further out and needle slightly towards to get to the muscles on the front side of the vertebra, okay? Don't do that today, please. Don't do that in front of me. Know that that was done, is frequently done. And if those muscles have tightened on the inside, the only way to get to those muscles is to go from a Hua Tuo and come in at an angle so you're not going to hit the lungs or anything, but to get to the front of the vertebra. But that's no longer allowed in today's acupuncture world, so to know, not to do, okay? Now, depending on the patient and what happens, I may start low, work up. I may start mid, work up, work down. But we're going to assume that this person has upper body tightness and pain from maybe a fall. And so I'm going to pay attention to where the muscles come. And if you look at me, when I tilt my head, these muscles engage. And then when I come back, they relax. And they're basically the cables that hold the other side of my head. So if you've ever had a horse pull, it's kind of like the horse pulls and you're kind of like holding the back and then they relax, holding the back. These muscles, as the head goes forward, they're like, whoa, don't go too far forward. And then you bring it back, like, oh, okay, I can relax. Whoop, that's what these guys do, okay? If a person has an injury to the shoulder, to part of the body, to a pelvis shifting or something, the Hua Tuo points are not the first place we go. This is not the start, unless we already know that they're constantly telling you they're having to move their spine, or they give you some clue, some hint that you have to go to the Hua Tuo right away, okay? That's not where we start, because even if the Hua Tuo are culprits and we treat the Hua Tuo, if there's the larger muscles also injured and pulling, the Hua Tuo isn't going to do enough to allow it to fix, and the bigger muscles are just going to pull the spine back back into tightness or into the wrong space. I talked about it in these videos. I've talked about it in the past, the concept of the onion effect, which, as I think about it, I'm not sure why I came up with an onion in terms of layers, but big to small. If we get rid of the big things, there's a good chance the small things resolve on their own. If we treat the small things, the big things never go away, and so the small things come back. And I really want us to understand that that's really important to grasp with the Hua Tuo points ahead of time and the do channel. That being said, if we've treated Asher work for what seems obvious muscles and we got the jumps and there is improvement, but there's almost like a reins of a horse holding our improvement in, or we've plateaued and suddenly there's no further improvement, that's when we want to start suspecting we have to get all the way along the spine to those little muscles that aren't used to being like a bicep, tight, relax, all day long, our hands, our thighs. Those muscles along the spine, they're not designed to have that huge amount of movement. So when they all go, they're not used to relaxing back up like a sponge slowly filling with water. And if they get yanked out of place, they're not used to going back to a certain sourness or gatheredness to hold the spine in place. They're just not used to that motion, in which case we can expect it will not go back to proper place. Common sense, yes?